In this presentation, I'm going to show you our recent results on the development and tests of photonic system for optically guided surgery for the treatment of liver cancer. This is so this work has been done in the collaboration between Aston University, University of Hull, and Oriel State University, and Oriel Regional Clinical Hospital. This is a short outline of my talk, and this work was specifically dedicated to the liver cancer diagnosis and treatment during minimally invasive surgery. Liver cancer as a disease can be characterized by extremely low survival rate, and actually without any improvements in recent years. Nevertheless, we know and we believe that early diagnosis of the abnormal tissue with a radical tumor resection can significantly improve the situation with the survival rate. One of the directions for that can be the use of modern optical and photonics technologies, such as optical biopsy, for the tumor discovery and localization. The use of the optical biopsy in the guided surgery can potentially significantly improve the quality of tumor resection and, more importantly, to decrease the rate of the false negative biopsies, which is crucial, especially for survival and quality of life for patients. What's about the cancer? The liver cancer and cancer overall, its distinctive feature is a slightly different type of metabolism with a disbalance in the production of oxygen, reactive oxygen species, and in main way of the energy production of the cells. On cellular level, the malicious tissue can be discovered by changed proportion of endogenous fluorescence associated with the energy production of the cell. Such substances like NADH and FAD, they disbalance, resulting in the changed fluorescence spectrum. On tissue level, the malignant tumor can be characterized also by the changed mechanical properties, alternated microvascular structure, and changed oxygen consumption. And most of that parameters we can evaluate by optical tools. We can measure fluorescence, we can measure blood supply, we can combine that technologies in a frame of an optical biopsy approach. Here you can see an example of the implementation of fluorescence and blood flow parameters measurements through a developed needle optical probe. And so we did that measurements in Oriel Regional Clinical Hospital. And what we've found that in frame of conducted preliminary clinical trials, we've found that the fluorescence spectrum from liver tumors with excitation at UV and blue light has changed shape and shifted position of the intensity peak, like it's here. Also, the oxygen saturation of blood is increased in cancer tissue. So that changed spectrum shape, fluorescence spectrum, we can try to use and to pick up feature space from that to apply on the input of machine learning techniques and probably to build a classifiers for automated classification of the normal tissue and cancer tissue. In this present work, we analyze the possibility to distinguish tumor tissues in liver and bile duct by the fluorescence spectra and by the features of blood flow in tiny vessels in the bile duct, in the tumor. We developed a system to do that measurement. The system can register tissue fluorescence with the excitation at 365 nanometers, at 150 nanometers, and also simultaneously with the fluorescence, we can measure blood flow using laser Doppler technique at with a laser at 1064 nanometers. They used fiber-optical probe and developed fiber-optical probe allowed us to implement the multimodal measurements simultaneously. The proposed setup was validated in the framework of limited tests in patients with liver cancer and obstructive jaundice when there's some problems with bile duct caused by liver cancer. The patient cohort consisted of 27 volunteers. During planned surgical procedure for an apparent tumor block and adjacent normal tissue, what we did, we measured a set of fluorescent spectra, and also in the middle of the tumor block, we measured 1 minute long recording of blood perfusion, and in adjacent normal tissue, we did the same. And after that, we did data processing and data analysis. During the measurements, we've identified several limitations. One of them is the difficulty to accurately place the probe in the area of cancer cells, of the distribution of cancer cells, and eliminate the presence of the blood in the field of view. Blood significantly affects the level of fluorescence spectra and, more importantly, changes its shape. Also, the variable pressure applied to the probe can be an issue, actually. Yeah, and that should be improved. We are going to do that in our next measurements. Here you can see some examples of the recorded fluorescence spectra. That's actual spectra from patients from their bile duct measured during the minimally invasive surgical procedure. Actually, the information about the tissue type is encoded in their shape in most proportion, and in minor proportion in the intensity of the fluorescence. To extract promising feature space from the recorded data set, the formalism of principal component analysis has been applied. We identified that the first and the second components are responsible for 90–95% of the total data variability. On the next step, the feature space of that, the first and the second components with a reduced dimension, significantly reduced dimension, was used as input for the machine learning algorithms. The data processing of the blood perfusion consisted in the calculation of the integrated wavelet spectrum with the subsequent identification of amplitude of the blood flow oscillations. We analyzed 3 dedicated frequency regions related to the physiological activities of myogenic activities, that's low frequency oscillations, respiratory waves, these middle frequency oscillations on the frequency of the breathing, and the oscillations associated with the heart activity. Actually, it's heartbeat, pulse, how the blood pulsates in the tumor and how the blood pulsates in the normal tissue. And we've got quite interesting statistics that in the tumor tissue, the cardiac and respiratory oscillations are significantly lower, like it's here. And this fact can be explained by the
two minutes.
Okay, changed vascular structure as well as by alternated mechanical properties in tumor tissue. That's how we explain that. That identified parameters were used to build and set and test machine learning classification models. That's the results of that. Such algorithms like k-nearest neighbors, decision tree, support vector machine, random forest, and AdaBoost were tested. For the data on fluorescence, k-nearest neighbors and AdaBoost demonstrated better results. Whereas both excitation wavelets has shown similar performance. That means that probably in the next generation of the system, just only one wavelength can be used, apparently 450 nanometers, to get rid of UV radiation. The classification based on the oscillations in the blood perfusion demonstrated slightly better results. The parameters of the cardiac oscillations together with the logistic regression possesses better predictive value. Our conclusions. We believe that this combination of the measurements implemented in vivo and in the settings of the real surgical intervention are quite pioneering, though the conducted studies are rather pilot and rather it's a kind of demonstration. The identified limitations prevented us from achieving probably exemplary accuracy for the classification. But for the first time, we demonstrated that for the liver cancer diagnosis, the endogenous fluorescence detection by the fiber-optical probe can be supplemented by parallel collection and classification of data on the perfusion oscillations. So authors acknowledge support from Russian Science Foundation, H2020 Marie Curie Innovative Program, and Academia of Finland. So that's our finding. So thank you for your attention. Be happy to answer questions.